It took 5 years of development across the chemistry, the microfluidic component, the physical aspect of the test, the computer vision algorithms that reads the test, then the mobile app that interprets the results, proprietary metrics that we've developed with our medical team, like the hormone scores. So there's a lot of different aspects in a product like this one, more than 12 inventions across those different areas. But to date, enables people with that test.
Welcome back to the Fitt Insider Podcast. I'm your host, Joe Veneri. Today I'm joined by Marina Pavlovic Rivas, co-founder and CEO of Eli Health. In this episode, we discuss the company's saliva-based hormone testing technology, plus we cover its 5-year R&D journey, how they developed an instant cortisol test, and using real-time hormone data to improve health outcomes. Let's get into it. The Fitt Insider Podcast is presented by EGYM. EGYM's smart fitness ecosystem is transforming healthcare through exercise. Combining strength equipment with AI-powered software and corporate wellness platform WellPass, it's leading the shift to proactive preventative health. Learn more about EGYM's intelligent workout solutions at egym.com. Hi, Marina. Welcome to Fitt Insider. Thanks for joining us.
Hi, Joe. Thanks for having me.
I've been keeping up with what you're working on, I think now for at least a couple years. I know you maybe had a funding announcement a couple years ago, got on the radar, and then CES was kind of like a big, I don't know if it was a launch or certainly a lot of like publicity and press, which was exciting. So for folks who aren't familiar, maybe just to kick things off, could you introduce yourself and tell us about Eli Health?
Yes, so I'm the co-founder and CEO of the company, and what we're developing is a test that measures hormones instantly in saliva. So really the vision that we have when started the company was to enable people to access hormonal data instantly, anytime, anywhere.
And in terms of when you think about, now the evolution of consumers getting their own health data, biomarkers, all sorts of things from blood tests to, glucose, how easy or hard or even what other options are there for people to get like real-time hormone data?
Yeah, so when we started the company, it was a bit more than 5 years ago. So, first of all, we're very excited that the world is going in the direction that we envisioned. But still, today, if you want to access hormonal data, especially when you're looking for hormone data outside of fertility, the options today are either to go physically at a lab or to order a sample collection kit. So, companies that enable you to buy the test online, receive it at home, and then ship it back, which provides a much greater accessibility than going somewhere physically, but that is still too slow and expensive to do real-time testing and do it frequently over time.
And in terms of like getting to the point where you can do it real time with saliva, also have the kind of analysis and software piece that you've built on top of that. What does the user experience look like, with your testing, and how did you get to that point? Because I would imagine it's not just as simple as, oh, hey, we have the testing and the analysis and the app and everything that goes along with it.
Yeah, so it was a 5 years journey. So it initially started from a personal need. My background is in data science. So as a data scientist, I wanted to have access to information when it comes to making health decision. But we saw a very big gap when it comes to hormone data. And hormone touches all areas of health. But if you want to access the data today, you have access to it a couple times per year if you're lucky. But most of the time, given the cost and timeline, you have access to it on a yearly basis and sometimes not even. So, from that vision, we then started the company, and it took 5 years of development across the chemistry, the microfluidic component, the physical aspect of the test, the computer vision algorithms that reads the test, then the mobile app that interprets the results, proprietary metrics that we've developed with our medical team, like the hormone scores. So there's a lot of different aspects in the product like this one, more than 12 inventions across those different areas. But to date, enables people with that test that they put on their tongue for a few seconds, pull on the tab, take a picture, and get the results almost instantly.
And in terms of using that, you talked about what the experience is like and super seamless, right? Really easy to use. How often are people taking that test? What are they measuring? So, what are like the use cases that you're seeing now? You talked a little bit about fertility, but also some different applications, I'm sure.
Yeah, so what we've built and the reason why we chose a format like this one, because when we started, it really started from a need and not a specific form factor. And we decided to use saliva because it enables that flexibility in terms of frequency of use. So there's some people, for example, when we look at their cortisol test, that is today the first instant cortisol test. Some people will test only, let's say, 2 days a month to see how that trend evolves. Once in the morning, once in the evening to really catch that full cortisol diurnal curve. But other people want to test much more frequently than that. We have athletes, for example, testing more than 5 times per day in order
Wow.
to see with, let's say, practice, what's the impact of cortisol versus game day, and adapting based on that. So in terms of use cases that we're targeting, I've mentioned fertility earlier, but that's really when we look at the market today. Fertility tools, there's a lot of them, but when you look outside of that, really hormones when it comes to overall health, that's the big gap, and that's the gap we're addressing. So think, for example, of women going through perimenopause, women having endocrine conditions like PCOS, endometriosis, but also people more broadly who want to use that information to improve their health. And that includes men, of course, with hormones like cortisol.
There's the kind of the obvious, like when you get beyond the fertility and you talk about hormones, which is hugely important. But as you point out, there's been kind of a surge of companies kind of filling that void. And while that's incredibly important, that's not where hormone health ends, certainly. And beyond people talking about cortisol, I don't know that most people, the average person, understands even really what they should be looking for, or maybe what that reading means, or how it can impact overall health. How are you at this point, like educating people? Here's what, not only what the reading means in terms of the score, but just like, hey, this is what you might want to look out for. Here's how it's impacting your health, or here's changes that you could make based on these readings that could impact your performance or stress or well being.
Yeah, so what we're seeing, it's a very interesting moment in time where there's a lot of interest and awareness around biomarkers like cortisol. There's a lot of information out there from health influencers or key opinion leaders like, let's say, Huberman, that have protocols on how to influence a hormone like cortisol. It even reached mass media adoption where it's being spoken at scale. So lots of information, some of it accurate and valid and useful, some of it not necessarily. But what's missing is really the ability to test, because there's all those protocols out there. But really, if you want to see if that's working or not, your only option before having a test like Eli was to go physically at a lab or to order those sample collection kits that are too expensive and slow to create that feedback loop that you want to have on a daily or frequent basis. So we're launching the product in a context where that awareness already exists, but that feedback loop and that data portion was missing. So that's something that's helpful for us as a company, since a lot of the education is out there. But what we provide directly within the app, in addition to, of course, the actual data, it's information that has been vetted by the medical team. and more precise guidance based on your own personal patterns.
At this point, you mentioned, starting 5 years ago, and a lot of the kind of tailwinds of influencers and protocols and all these things timed really nicely. You mentioned having the kind of personal need for a product like this, but as it was in development, and even now as you're launching into market and scaling up, like, could you have predicted that like things would have played out this way, or it's just really fortunate that they aligned and you were on that path already?
Well, when we started the company and how we like to approach things more broadly, it's from a first principles standpoint. And when it comes to, especially when looking at AI, data science, machine learning, already 10 years ago, it was a popular topic, not as much as today, but still gaining traction. And when we were thinking of what's the future of different industries, including health and wellness, with different trends that AI could enable. Something that we saw as inevitable is that ultimately machine learning would enable that personalized approach to health. And the question was when? Is it 3 years, 5 years, 10 years? But something that would inevitably happen. And with that increased information and increased availability of data, that it changes also the different options and opportunities in terms of having those different health protocols and approaches. But for sure, seeing things like, let's say, COVID, that's something we didn't see coming at all, like most people, and that accelerated many of the trends we're working with.
Yeah, just the not only ability for the technology to work, right, which is a huge piece of this puzzle, but like you said, the COVID, the acceptance of kind of the at-home testing or instant testing, and then that leading to the desire, hey, why can't we have this for every biomarker or every aspect of health and apply that to every area? When you think about your getting the product in market and you have, yes, like the influencer piece, the kind of key thought leader experts, Hubermans, Peter Tia driving awareness. What is working for you in terms of adoption, awareness, like getting the product out there, getting users to try it? How do you think about doing that while also balancing it with, hey, we want to make sure it's known that this is science backed and we have a team of experts ourselves and we're recommending things that are, vetted, balancing that kind of the blurred lines between wellness, quote unquote, which kind of like anything goes, with like medicine, which might be a little bit too much of the paternalistic and, you don't have access to your data world.
Yeah, so that's really an important balance. And for this type of approach, we're inspired by other products on the market when it comes to, let's say, smartwatches, wearables, continuous glucose monitors, especially when it comes to using those tools in a wellness angle and seeing what's the line between providing different insights, recommendation, but not making diagnosis, but still raising a flag if something is not normal. So we have similar approaches when it comes to our product. But really, for us, the foundations was that 5 years of R&D to make sure that first the test is accurate, third party validated, that all the information that we include in the app comes from existing research, that this research was validated by our a medical team, and that we build our algorithms based on that vetted information. But then when it comes to the different protocols that we're recommending, we're focusing on lifestyle, but still enabling people to see if something is not like it should and encouraging them to get help elsewhere. And that's also something we're working with other partners in order to not just be broad, but have different resources that we can recommend.
Yeah, I was going to ask about that, whether it's supplements if like, hey, there's a deficiency or something that can improve this, or specialized care in terms of like actually seeing a doctor or another functional medicine expert, potentially even integrating further into healthcare if this is kind of like the on ramp and people are getting their own data, like how do we use it, where do we apply it, just how do you think about those partnerships and the areas where it can be applied and it does make sense to either recommend or partner with established, healthcare providers, or even kind of just like brands that are developing supplements or other kind of ancillary services.
We're seeing an opportunity to fuel a whole ecosystem. And that's also why we call the product Hormometer, similarly to a thermometer or glucometer. What the product does is providing the hormone data instantly. And hormones, given that they play a role in all bodily functions, all areas of health, the number of partnerships that are relevant with this data, as you can imagine, is pretty broad across, yes, of course, supplements, but also different type of telemedicine providers, emerging models in longevity care. So our vision there is to be the data source for those various players in the ecosystem and enable those companies and those partners to have their clients or patients access this data through the app and the product.
Yeah, it's really smart. There's a huge opportunity because even when you think of this trend continuing, where what was lacking previously was the ability to do some of this testing in real time, and then also the feedback loop. So like, oh, you take this supplement, what is it doing? Or if you're a clinic, or we have preventative health and longevity and all these other clinics now starting to emerge, well, don't we want to be able to test somebody's hormone levels just like we access their Oura Ring data on a daily basis to pull this into the protocol? So really, there's a limited, as you pointed out, like a limited number of options for them to say, hey, could we even factor this information in real time or on a regular basis? Have you begun to do that yet? Or is it just kind of like on the roadmap? Obviously, this is somewhere we want to go with partnerships.
So we've begun some of those partnerships. They're not publicly announced yet, but
Yep.
it's in some of them are in progress. So it's been exciting to see how the product can fit into those offerings.
From a business model perspective, the tests, the kind of device itself, the app, how are you pricing all that, and what does that look like on the consumer side?
So on the consumer side, it's a subscription model. So people can choose between a yearly subscription, 3-month subscription. We also give the possibility to buy just a discovery pack without that subscription aspect for people who are just curious to test out and see if it's a fit for them. And it starts at $8 per test.
This episode of the Fit Insider Podcast is brought to you by EGYM. EGYM makes some of the most innovative strength training machines on the market, but that's only one part of their integrated ecosystem. With connected fitness equipment, AI-powered gym software, and a comprehensive corporate wellness offering, it's forging the future of preventative health. Partnering with companies worldwide, eGym's WellPass program improves employee health by expanding access to premier fitness and health facilities. Upgrading gym floors, eGym equips every operator with smart equipment and AI tools to create hyper-personalized training plans for every exerciser. Putting it all together, they're transforming healthcare through exercise. Experience the power of eGym's ecosystem at egym.com. We've talked a little bit about like glucose, but that's somewhat different in that it's a device, you're wearing it all the time. Some people, if you have an aversion to needles, maybe you're not, you wouldn't be inclined to do something like that. And it's also can be more cost prohibitive in terms of using it, and then a lot of the subscriptions that come on top of that. But whether it's sweat and hydration, is another one that's kind of similar. We're starting to get readings and devices and test strips and things that give more clarity on it, but it's certainly not mainstream in a way that most people understand. Hey, are these electrolyte drinks that I'm drinking, is it doing anything? Do I need them? How much water? So when you think of just like this whole world of the biomarkers and all the things you could measure and monitor, is the way that you think about it, hey, we want to go deeper into hormones, or is there, how do we go more broad into other metrics that we can track and provide solutions for?
Yeah, that's a great question. When we look far ahead, we see our platform and the IP that we've developed being able to adapt to other biomarkers beyond hormones. But for the time being, we're seeing so many gaps in the hormonal health space that this remains our focus. And similarly to how we've created the first instant cortisol test, we plan to do the same for other key biomarkers, including testosterone, that can also inform a lot of lifestyle changes, yes, for men, but also for women.
Yeah, I was going to ask about that because one, when you brought up Huberman, you talk about protocols and the number of things and the amount of money men in particular are willing to spend to potentially optimize their testosterone. And short of, hopefully at minimum you're getting regular blood work done, but assuming that most people aren't, whether it's supplementation or just routine, or even as this conversation around hormone replacement therapy or TRT gets more mainstream, it's like, hey, how are we tracking this? How do we know who needs it? So there's certainly an unlimited number of applications for that just within this like very much subsegment of Huberman optimization. But menopause, the awareness now of testosterone and hormones role for women throughout aging, longevity, the ability to do that. How do you see like the different biomarkers coming online? Like, do you have a timetable? Is it a matter of perfecting the kind of technology or the testing? How does that get to market when you say like, hey, we envision bringing some of these other hormones into light?
So it's relatively soon. For some of them, the development is already quite far. For others, it will start this year. So the heavy lifting in terms of R&D was done over those 5 years, and now it's a question of adapting to those other hormones. But what was really challenging from R&D standpoint was being able to detect those extremely small levels present in saliva, work with saliva as a fluid, which is something that is known as being super challenging from a scientific standpoint. And that overall IP is then something that can be way more easily adapted than starting from scratch. And what's really interesting to see from a market standpoint is that when we think of that feedback loop, most of the time it's the behavior change that is the most challenging part to do, really taking the action to try different protocols and see what's the impact. And what we're noticing in the market is that there's already large number of people who are implementing those behavior change, which is something amazing to see. But as you mentioned, spending a lot of money, lots of time, but having limited ways to see is it actually working or not beyond the subjective evaluation.
Yeah, and maybe recognizing that probably not everyone who's listening is, a scientist or biologist or has experience deep in the kind of medical aspects of what it would take. You talk about like working with saliva and the R&D that went into it. Like, what are those challenges? Why wasn't this possible? And if you can do it in simple terms, just say like, these are kind of the dots that we were able to connect, and like now that means we can continue to scale it and apply it to different things. And that is when you talk about IP and the barriers that you've overcome, like the kind of actual achievement or boxes that you've been able to check.
Yeah, so from a scientific standpoint, the use of saliva is something that is already recognized as valid, even if it's less common. So, for example, blood tests are way more common than saliva tests, but it's still something that is being used even today in a clinical setting. For example, cortisol. You can go to a clinic and your cortisol will be tested in saliva sometimes. So, that's already a known fact that hormones can be detected in saliva. But from a technological standpoint, making that accessible in a form factor that you can have at home, one of the key challenges is the limit of detection. So, although hormones in saliva are correlated with hormones in blood, their absolute level are uh, magnitudes many magnitudes smaller. For some hormones, more than 1,000 times smaller. For other, more than 10,000 times smaller. So being able to have the limit of detection, so basically being able to detect those extremely small level was one of the biggest challenge, and being able to work with saliva that has different consistencies, that reacts differently when it flows, was also one of the big factors to overcome. But even with those two factors combined overcome, there's still the overall question of what's the form factor and how can we enable people with a single step to collect saliva without having to do additional mixing of liquids, waiting, and creating basically a mini lab at home. That's not what we were envisioning. So that whole packaging of that experience and that system and something that's user friendly was also something quite challenging, and that required expertise from the microfluidic standpoint, mechanical engineering standpoint, to make that one step process. And then, of course, the app and computer vision aspect of it. Initially, we had a reader, dedicated hardware in which we would need to insert the test, but we found a way to replace it with AI instead.
I mean, what you're talking about in the type of R&D that has gone into it, it's not dissimilar to what you see a lot of times in like a biotech company or, a pharma drug where it's like years and years and years in development. And, there's all types of different ways that can be financed and approached because the go to market is going to take whatever that extended period of time is. For a consumer startup, that's a little bit different, especially when you're talking about trying to raise money for a pre-product or pre-revenue or all these sorts of things. How are you able to do that from a funding and financing side to say like, yeah, it's going to take as long as it takes to get the product itself actually ready to go to market?
Yeah, so that's a really good point you brought in, and that friction is definitely something that we saw, because on the one hand, we are a medical device company, biotech company. We have the R&D infrastructure. We build our own labs internally. So from that perspective, the process and milestone is the same as a medical device and biotech company. But at the same time, we're also a consumer facing company. And often those two worlds don't necessarily overlap. So, and it's also quite capital intensive in the sense that upfront funding is required to do that R&D for years. So in our case, we found venture capital investors who were deeply aligned with their vision, people that were seeing that gap and in many cases experiencing that gap personally, and who were seeing also where the future was going and the gap that existed. And because they were seeing so clearly that future and the need that a tool like this one would solve, were then able to have the patience to wait for that development to happen.
And it's an exciting time, I'm sure, as it continues now to see it get out into the world and people are using it and having different not only use cases, but as you mentioned, like the hormones that you'll be able to detect. There's also shifting gears from you essentially built this entire medical device R&D. Now it's like, okay, what does it look like to scale marketing and all these other things that come along with it? Just how have you approached that, from whether it's team building or priorities and roadmap that you're talking about and conveying like, hey, now we're kind of shifting or transitioning and these things are becoming more of a focus or where we're putting attention and resources?
Yeah, so for sure, in this new phase, there's other areas of the company that are being created, accelerating. But something that was really helpful for us is since the beginning of the company, we were always very close with the users. They were involved at each step of the process, from defining the form factor to testing each versions of the prototypes when we've built the brand was a lot with the input that we had from the thousands of people we spoke with. So from a cultural standpoint, the company during those years of R&D was not in a mindset of we're just building isolated from that marketing angle or from that user angle. It was always really integrated piece of the puzzle, which now makes that transition much smoother by having that mindset since the beginning.
Yeah, if you could, I think that's really interesting because, a lot of people talk about building community or community being central to the messaging, marketing, whatever it might be. And that is incredibly difficult to do if you're not intentionally and organically doing it from the beginning. One, like, where did those people come from as you're, like, starting to build this thing? And was that the intent to say, like, hey, we are going to kind of hand in hand with the users, like, build the thing that they're kind of asking for, so we know we have that product market fit? That a lot of times, if you build something in isolation, you turn around and try to launch it, and it's like there's no there's nobody there, or you maybe have to force it in a way that it sounds like you didn't have to.
Yeah, so for us, it happened initially very organically because it came from that personal need. And we just wondered, am I alone feeling that need? And speaking with people around me and around us with my co founder, we saw that I was far from being alone. And the more we were talking with people, the more we were uncovering other areas of unmet needs because initially it was around hormonal symptoms that we can experience beyond fertility, but then discovered that during the fertility process there is a lot of insatisfaction. Same for endocrine conditions, same for perimenopause, all areas that we were not personally familiar with, but that we saw the same dissatisfaction. And from those conversations, I remember all the consumer discovery calls that we were doing with users one on one and asking, do you have other people that would be interested in speaking with us? And many times we would have people we speak with that were referring us to 5 people, 10 people, 30 people, because the urgency that they were feeling around those needs was so high that we were seeing that motivation that was very clear. So it just went from a call to another, a discussion to another. And when we were seeing the value, of course, of having that feedback, that's something we made sure to integrate at each step of the process because we knew it would be taking a long time and we couldn't afford to build something and then realize months or a year later that it was not the right one. So we're glad that we did because the original ideas that we had around doing a patch, doing using sweat, using interstitial fluid, using many other form factors that we were thinking about through those discussions, it's really what shaped ultimately what ended up being the product.
As we wrap up and you think about, we kind of talked about a lot of different things in terms of potentially some partnerships to maybe look out for that you're working on, some additional hormones and tests that might be coming out. Yeah, just what are you looking forward to? What are you excited about? Is there anything that we should be on the lookout for?
There's lots of things coming out in the company in the next few months to keep an eye for. But more broadly, what we're very excited about in terms of where the industry is going is especially as we see AI models and AI tools becoming more and more accessible. We believe that the missing piece or the piece that will remain extremely important is the data sources. So that's something as a company that we're extremely excited about because those AI models, regardless of the company that you have, will become accessible, but they will only be as useful as the data that is being fed into it. And that's really how we see our positioning as the company and with our product is the data collection tool. And without that collection, there's nothing else that can happen. So we're really excited about the different tools that are being created also in the industry across different biomarkers, because ultimately with this data that is being created, it's really ultimately how people will be able to get the value.
Yeah, very quickly could turn out to be one of the larger, if not the largest source of hormone data that then what are you able to do, to your point, with that data and those inputs that other companies might be interested in and that you might be able to develop then additional things on top of. So yeah, there's huge potential there as well.
Exactly. So that's something we're extremely excited about as a company, to be creating that data set for the very first time, data set of instant hormone data that we can collect frequently over time and across a large population. So I was mentioning earlier the existing research that exists around the different actions that people can take based on those hormonal levels. But we're also very excited about the new insights that we'll be able to uncover from that database. So that's something we're extremely excited to work with partners that have various use cases and that can help us ultimately enable people to improve their health and wellness throughout their life.
Perfect. Well, as all this continues to take shape, where should people go to follow along, learn more, get a test, all those sorts of things?
So they should head to our website, eli.health, and that's where they'll be able to get a test, join the waitlist, and also look out for roles, because we'll have many new roles that will open in the next few weeks.
Perfect. We'll get everything linked up in the show notes. But thank you so much for spending some time today. It was a great conversation. Super excited to share it with the listeners.
Well, thanks a lot for the invite.
Thanks for listening to today's episode. If you got value from the conversation, please consider subscribing and sharing the podcast with a friend or colleague. It's a massive help. And if you want more content like this, including news and insights on the latest industry developments, subscribe to the Fitt Insider newsletter at insider.fit.co. And one more thing, you can learn more about our recruiting and consulting services at fit.co. That's FITT.co. I'll see you here next week.